So, good day everyone. My name is Juan Miguel o Apat, and I will discuss and perform the assessing the head, face, neck, eyes, and ears. So, definition. Health assessment is the collection of data. Physical examination is a head-to-toe review of each body system that offers objective information about the client and allow healthcare provider to make clinical judgment. Purpose for health assessment: to make clinical judgment or diagnosis about an individual's health state or condition, and to obtain baseline data for clients' functional ability. For physical examination, for routine screening to determine the client's eligibility for health insurance, for acquiring new job, and for client's admission to the hospital. Procedure number 1. Identify the client and explain procedure. Rationale: this is to ensure that the procedure is done to right patient, to reduce fear or anxiety, thus promoting the patient's cooperation. So, good day po, ma'am. May I know what is your name?
Gertrude's Apat.
So today, i-assess ko po yung mga mga body parts niyo po, ma'am. Okay lang po ba?
Yes.
Thank you. Procedure number 2. Properly position the patient. Rationale: this ensured easy access to the body parts to be assessed and the patient feels comfortable. So, may I ask kung ano po yung position na mas preferable niyo po, ma'am? Yung pahiga or yung sitting position lang po?
Paghiga.
Pahiga? Sige. Next is take the patient health history. Rationale: to have a comparison from the previous and from the present health condition. And for procedure number 4, conduct a physical examination using the skill in physical assessment, inspection, palpation, percussion, and oscillation. Rationale: to determine the abnormal findings in the body system. So today we are going to assess the head. For the hair, we are going to assess the evenness, texture, and oiliness. The method that we're going to use is inspection. Rationale, or the normal result: evenly distributed, silky, resilient hair. So I'm going to assess or check your hair po, ma'am. Next is thickness and thinness. The method that we're going to use is inspection. Rationale: it should be thick hair. Next is infection and infestation of lice. Rationale. Method we are going to use is inspection. Rationale, or the normal result: no infection and infestation. Now, we are going to assess the skull and face. For skull size, shape, and symmetry, the method that we're going to use is palpation and inspection. Rationale, or the normal result: rounded, normal cephalic, and symmetric of parietal, frontal, and occipital prominences, smooth contour. Next is skull nodules or masses and depression. The method that we're going to use is palpation. Rationale, or the normal result: it should be smooth and absence of nodules or masses. Next is symmetry of facial movement. Rationally, or the normal result, symmetrically facial movement. So now, we are going to assess the eye structure and visual acuity. Inspect the eyebrow for hair distribution. The method that we're going to use is inspection. Rationally, or the normal result, hair evenly distributed, skin intact, symmetrically aligned, equal movement. So, check ko lang po yung eyebrows ko. Next is eyelids, ability of blinking. The method that we're going to use is inspection. Rationally, or the normal result, lids must close symmetrical. So, can you blink, ma'am? Thank you. Next is conjunction, lining of eyelids by reversing the lids. Method we're going to use is inspection. Rationally, or the normal result, smooth, shiny, pink, or red. Next is cornea, clarity and texture. The method we're going to use is inspection. Rationally, or the normal result, it should be transparent, smooth, shiny, and the iris are visible. Next is pupil color and symmetry of size. Method we're going to use is inspection. Rationally, or the normal result, black in color, equal in size, usually 3 to 7 micrometer in diameter, and it is flat and round. Next is pupil reaction to light. The method that we're going to use is inspection. Rationally, or the normal result, pupil or illuminated pupil constrict, direct response. Non-illuminated pupil constrict. Next is reaction to accommodation. The method we're going to use is inspection. Rationally, or the normal result, pupil constrict when looking at near object, dilate when looking at far object, and for the converge, object is moved towards the nose. So, ma'am, can you follow my finger ko, ma'am? Next is we are going to assess the ears. For Urachel, color symmetry, color symmetry. The method that we're going to use is inspection. Rationally, or the normal result, same color as facial skin. Check ko lang po yung ears niyo po, ma'am. Thank you. Next is Urachel, elasticity and areas for tenderness. The method that we're going to use is palpation. Rationally, or the normal result, Mobile, firm, not tender. Penna, recoil after folded. Next is hearing acuity. Client responds to normal voice tones. Rationally, or the normal result. Normal voice tones audible. 1, 2, 3, 4, 5. Next is client responds to whispered voice, non-consecutive number. Rationally, or the normal result, able to repeat non-consecutive number. 1, 3, 5, 4, 3. Now, we are going to assess the nose. External nose for any deviation for shape, size, color, and flaring or discharge from nares. Method that we're going to use is inspection. Rationally, or the normal result, symmetric and straight, no discharge of flaring, and uniform in color. Next is external nose to determine the areas of tenderness, masses, and displacement of bone and cartilage. Bones and cartilage. The method that we're going to use is palpation. Rationally, or the normal result, not tender, no lesions. Now, we are going to assess the mouth and oropharynx. First is lip and vocal mucosa. The method that we are going to use is inspection. Rationally, uniform pink in color. Next is teeth and gums. The method that we're going to use is inspection. Rationally, or the normal result, pinkish gum, smooth white, shiny tooth enamel. Open your mouth, ma'am. Okay. Next is tongue, floor of the mouth. The method that we're going to use is inspection. Rationally, or the normal result, central position. Open your mouth, ma'am. Your tongue. Next is tongue movement. The method that we're going to use is inspection. Rationally, or the normal result, move freely, no tenderness. Can you open your mouth, ma'am? Can you move your tongue, left and right? Okay, thank you. Next is oropharynx and tonsil. Inspect the color, texture of the oropharynx The method that we're going to use is inspection. Rationally, or the normal result, it should be pink, smooth, posterior wall. Open your mouth, ma'am. Thank you. Now, we're going to assess the neck. Inspect the neck muscle. The method that we're going to use is inspection. Rationally, or the normal result, muscle equal in size, head centered. Neck, Next is observe the head movement. The method that we're going to use is palpation. Rationally, or the normal result, cooperated, smooth movement, no, do not show pain. Next is palpate the thyroid gland. Rationally, or the normal result, loads may not be palpated. And we should reposition the client rationally to ensure patient comfort. So, ano po yung prefer nyo na position, ma'am? Ganyan po ba? Okay, thank you. For the evaluation, make a finding for health assessment and physical examination done in the client. Rationally, this is our important data to convey the physician aid in diagnosis for the client. So, sa assessment po natin ngayon, ma'am, do you feel any pain or mga sakit po? None? None so far? Okay. So, for the documentation, record, document, or report the patient finding during the assessment to appropriate personnel. Then, the rationale, to provide accurate data in the care for the client. So, observe po natin po, ma'am, na sa assessment niyo po ngayon po, ma'am, lahat naman po ay normal sa assessment po natin. So, thank you for the cooperation for ma'am, for the assessment po, ma'am. Thank you so much. Thank you. Now, we are done on assessing the face, head, neck, eyes, and ears. Thank you for watching.